Good morning. So unfortunately, Maria Costa, she had an accident yesterday and she could not make it here. I did not know the presentation. She's from radio oncology. I'm a medical oncology fellow in Lisbon, but she asked me to just present the data so you could see the work that has been done in Porto and about radiotherapy combined with hyperthermia in the treatment of recurrence of cancer of the head and neck region and impacting early response and quality of life. So we know that diagnosis of head and neck cancer can be physically and emotionally debilitating. And the patients that have this diagnosis, they only have not only potential life-threatening disease, but they know that this treatment can cause disfigurement, disruptions of essential functioning, such as deficits and complications in eating, swallowing, breathing, and in speech. These patients normally have poor prognosis, and the majority of these patients are treated with palliative intent or with best supportive care. Most of these patients will have previously radical radiotherapy, would have reached the maximal acceptable tolerance for critical organs such as spinal cord or brainstem. Therefore, the re-radiation of these patients carries potential risks and complications. And we know that the effect of hyperthermia associated with radiotherapy has already been extensively demonstrated in a lot of oncology settings and plays an important role in recurrence disease, especially in previously irradiated patients. And this can be an option in patients with limited therapeutic possibilities. So we know also that this will result possibly in a complementary tumoricidal effect and can be achieved and a good result with acceptable toxicity. They use the Celsius TCS-42 system, a non-invasive medical equipment with capacitive hyperthermia through two active electrodes that emits a radio frequency and allows to raise the temperature in a focused way. And the objective of this experience was to see the association of hyperthermia and radiotherapy in the treatment of recurrent head and neck cancer in patients that have been previously irradiated, and see the impact of this treatment in early response and quality of life in the first Portuguese center that has hyperthermia treatments in Portugal. So it was analyzed retrospectively the data of 10 patients who underwent with this combination between March 2017 and August 2018. And all patients were treated with IMRT technique. So they have the same radiation schedule, which was 4 gray twice weekly, with a total of 32 gray, an interval of 3 days between fractions, 1 hour of hyperthermia once a week, and the time interval between radiotherapy and hyperthermia sessions was 30 minutes. I'm not a radio oncologist, so I cannot explain the plannings. I will move forward this part. And the results were that the treatments were well tolerated with acceptable toxicity. And the median follow-up period was for 5 months. And the complete response rate was 50%. And the remaining patients, they had a partial response, all of them, and with a good local palliation. And this can be, as I said, a good option for patients with limited therapeutic options. Here are some cases of these patients treated. Before treatment and after treatment in previously irradiated areas, here with a complete response. Here is another patient with the evaluation 2 months later. One more patient with also 2 months later the results of this association. And here with a good palliative control, at least, with a really extensive disease. So to conclude, hyperthermia and radiotherapy is effective, feasibly, and tolerated in combination to treat recurrent head and neck cancer in previously irradiated areas. And this can have a really good local control in these patients. We see a physical impact that you can see in the reduction of the tumor lesions with improvement of pain, bleeding, infection, and necrosis. But there's also an improvement in the psychological effects in such exposed areas for the patients. Although a long follow-up period is necessary to evaluate late reactions and the duration of these remissions. And thank you very much.